Pain control is something that many people worry about with joint replacement, and oftentimes it delays their presentation to my clinic. The good news is that there are a lot of newer strategies to deal with pain control beyond just taking narcotics. These include multimodal pain control, which includes a variety of different medications that can be taken, as well as procedures that can either be done before or after joint replacement to minimize the amount of pain that someone feels. In addition to using various medications to control pain, as well as the different procedures we can do before or after surgery, a few of the other things that I do to decrease pain with these types of procedures are making smaller incisions, as well as not using a tourniquet for a knee replacement, which is commonly used elsewhere. It goes at the top of the thigh and is inflated for anywhere from 30 minutes to an hour and a half. As you can imagine, that's a very painful thing to have, and many people complain of thigh pain more than knee pain when they wake up. One of my strategies to decrease pain is to not use a tourniquet at all. That can lead to some bleeding during the surgery, but we can control that carefully by taking our time, and that tends to lead to less pain after surgery, as well as less bleeding overall in the long run. Typically, a patient will experience some pain right after waking up. A lot of that pain nowadays is mitigated by the use of numbing medications during surgery. So that takes a lot of the pain away from the first day. It also helps us get people up and walking faster and home sooner. Probably the second and third days when people will experience the most pain. And we try to work on strategies to manage that pain, such as increasing the pain medications as the blocks are wearing off to have a smoother transition. Having an effective pain management strategy is critical for joint replacement, especially for knee replacement. If someone struggles with their pain control after surgery, they won't be able to work well with physical therapy. Consequently, they won't have good range of motion, and they'll end up with a knee that feels very stiff and tight. My goal is to work with the patient throughout the postoperative period to make sure that their pain is well managed. If something's not working well, we can change it, we can modify it, but our strategy needs to be a tolerable level of pain so that they can successfully work with physical therapy. There are a number of strategies that we can use for joint replacement in the weeks leading up to surgery. That can include a procedure in the clinic to numb nerves around the knee, which decreases pain after the procedure, and it also includes the multimodal pain control that we'll do at the time of surgery. That can also include administration of a number of medications before you go back to have your procedure done, which means that we're starting your pain control prior to the procedure itself, which has been shown to decrease your pain as you wake up.